Every 36 seconds, someone dies from heart disease, and clogged arteries are often the silent culprit. The truth is, by the time most people realize something is wrong, the damage is already advanced. Artery blockages don't always announce themselves with dramatic chest pain. They creep in quietly, sending subtle signals that many mistake for stress, aging, or simple fatigue. Plaque, a dangerous mix of cholesterol, fat, calcium, and cellular debris, builds inside artery walls, narrowing the passage and restricting blood flow. After age 50, risk rises sharply due to aging vessels, slower metabolism, and higher rates of high blood pressure, diabetes, and elevated cholesterol. Ignoring early signs can lead to heart attack, stroke, or peripheral artery disease. Today, you'll learn 7 silent warning signs your arteries may be narrowing, and how to protect your heart and your life. Number 1. Unexplained fatigue. One of the most overlooked early clues is deep, persistent exhaustion that lingers even after a full night's sleep. Poor circulation means less oxygen reaches your muscles and vital organs, so ordinary tasks, walking across a room, climbing a few stairs, carrying groceries, leave you unusually drained. This isn't just getting older. In women especially, unusual tiredness can be an early warning of coronary disease, sometimes weeks before a heart attack. If new disproportionate fatigue appears, especially with shortness of breath, dizziness, or mild chest pressure, get a cardiovascular evaluation. Early testing, blood work, ECG imaging, can detect reduced circulation and prevent a crisis. Number 2. Shortness of breath during light activity. Breathlessness with routine tasks can signal narrowed coronary arteries. When plaque reduces flow to the heart muscle, even mild exertion raises oxygen demand beyond what the arteries can deliver. People often dismiss this as poor fitness, but artery-related breathlessness often appears suddenly or worsens over time, even without weight gain or lifestyle changes. If you're winded by activities that used to be easy or short of breath at rest, seek prompt evaluation. Paired with chest tightness, dizziness, or clammy sweating, this may represent angina and an imminent heart attack risk. Tests like an ECG, echocardiogram, or stress test can uncover hidden blockages. Number 3. Pain, numbness, or cramps in the legs. Leg pain with walking that eases with rest, called claudication, is a hallmark of peripheral artery disease, PAD, caused by plaque in the leg arteries. You may feel sharp cramps, aching, heaviness, or numbness in the calves, thighs, or hips after short distances. Skin may look pale or bluish, and wounds may heal slowly. PAD is not just a limb issue, it's a powerful predictor of heart attack and stroke. If you're over 50, smoke, or have diabetes, high blood pressure, or high cholesterol, ask for an ankle brachial index (ABI) test. Detecting PAD early allows treatment that protects both your legs and your life. Number 4. Erectile dysfunction in men. ED is often an early circulation problem, not just hormones or stress. The penile arteries are smaller than coronary arteries, so plaque reduces blood flow there first, often years before chest symptoms appear. Men with ED have a significantly higher risk of future heart attack or stroke. Don't treat ED in isolation. If persistent, especially with high blood pressure, diabetes, or high cholesterol, request a cardiovascular workup to address the root cause and protect long-term heart health. Number 5. Cold hands and feet. Persistently cold extremities can reflect poor peripheral circulation from narrowed arteries. If your hands and feet remain cold despite warming, or you notice numbness, tingling, color changes, pale, bluish, or shiny skin, circulation may be compromised. While Raynaud's phenomenon can cause cold digits, PID is a more serious cause that demands evaluation. Ask for a vascular exam, ABI, or Doppler ultrasound to assess flow, especially if you're over 50 or have cardiovascular risk factors. Number 6. Jaw, neck, or back discomfort. Heart trouble isn't always chest pain. Reduced blood flow to the heart can cause referred pain to the jaw, neck, or upper back, especially in women. If discomfort appears with exertion or emotional stress and eases with rest, that pattern suggests angina. Don't dismiss it as dental issues or muscle strain. If these symptoms are new, recurrent, or accompanied by breathlessness, sweating, dizziness, or nausea, seek urgent evaluation. ECGs, stress tests, and imaging can reveal coronary narrowing before catastrophe strikes. Number 7. Mild swelling in feet or ankles. Persistent symmetrical swelling, peripheral edema, can indicate poor circulation and rising strain on the heart from narrowed arteries. It's often worse by day's end and improves overnight. Early on, pressing the swollen area may leave a small indentation, pitting. As it progresses, you may see tight shoes, sock marks, fatigue, shortness of breath, or unexpected weight gain, possible signs of heart failure. Don't ignore recurring edema. Ask for blood tests, an echocardiogram, and vascular studies to find and treat the cause. Prevention and AMP, action plan. You can't change age or genetics, but you can take control now. Quit smoking. Arterial damage improves immediately. Follow a heart-healthy pattern like the Mediterranean or DASH diet. Vegetables, fruits, whole grains, legumes, lean proteins, olive oil, nuts. Minimize processed meats, refined carbs, excess sugar. Move at least 150 minutes weekly, brisk walking, swimming, cycling, plus resistance training to improve circulation, weight, and blood sugar. Keep blood pressure near 120/80 unless your doctor advises otherwise. Manage cholesterol, weight, and diabetes aggressively. Schedule regular checkups, yearly if you're over 50 or sooner with risk factors. Ask about screening tools. A coronary calcium scan to detect early artery calcification, an ABI for PAD, and a stress test to assess flow under load. Silent signs of artery blockages are not harmless. They're your body's early SOS. Recognizing them now can mean the difference between a long, healthy life and sudden, irreversible consequences. If you're over 50, don't ignore these signals. Your heart may be whispering before it shouts. Have you or someone you love noticed any of these signs? Share your story in the comments. It might save a life. If this helped, like the video, share it with someone you care about, and subscribe for more life-saving health insights. Your heart is worth protecting, starting today.